Hello, and welcome back to this, the third lecture in our series on cardiac arrest, hypothermia, and resuscitation science. My name is Dr. Benjamin Abella, and I'll be speaking to you today on cooling the body to save the heart and brain, or therapeutic hypothermia after cardiac arrest. This is a topic that has engendered a lot of interest recently, as it represents one of the most exciting new therapies in the care of patients whose hearts have stopped, or patients who have had cardiac arrest. As many of you may have heard from the media and other things in current events, people whose hearts have stopped and then been restarted often suffer lasting brain injuries and other disabilities after resuscitation. And this therapy, known as therapeutic hypothermia, or the lowering of the core body temperature after resuscitation, has been shown to dramatically improve both survival as well as brain recovery after cardiac arrest. So we'll explore this topic together, but before we plunge into the science surrounding hypothermia, I wanted to give you the big picture of when people actually die from cardiac arrest. So this is a schematic illustration showing that if you have a set of patients who suffer a cardiac arrest, despite all the initial actions of resuscitation that we talked about in the first two lectures, such as CPR and defibrillation, most of these patients go on to die, and they go on to die fairly suddenly, meaning you do CPR, you attempt resuscitation, and you don't get them back. So you'll know instantly the results of your work if you're a healthcare provider. Now, it turns out that some people, of course, we do get back, and we call this ROSC, or return of spontaneous circulation. This is getting your pulse back or your circulation back. And this is that moment that's very dramatically portrayed in television shows when someone's been shocked or gotten CPR and they wake up. Now, in truth, they don't wake up right away. They're critically ill, and they're often immediately placed into an intensive care unit. And then something terrible happens. Despite most of these people getting their pulse back and initially being resuscitated from cardiac arrest, most of these patients go on to die, and they go on to die fairly acutely after